replicator made it possible to compare chewing and guided movements of the same subject. Hinge movements were performed by placing the thumb in the chin to retrude the mandible while vertically lifting the condyles with the fingers under the inferior border of the mandible on each side. The subject's guided hinge movement just shown is now being reproduced by the replicator. Right and left lateral movements were made by using firm hand guidance against the ramus of the mandible. The long cusps and deep fossa areas of opposing molars were of special interest during the non-working side movements. The casts were sectioned to more closely examine the nature of the opposing sliding inclines. Casts with removable dies provide students with a perspective that clearly shows how the steepness of the working side canines, coupled with the steepness of the non-working side eminence, directly influence the amount of separation of the non-working side gliding molar cusps located between these two controls. Non-working side molar collisions, or what is commonly referred to as balancing side interferences, have long been considered undesirable contacts disturbing to the muscles. The demonstration just shown can easily be made with articulator-mounted casts, but the replicator provided an opportunity to witness how the same teeth interacted during chewing. Here, the subject is chewing cheese to represent a soft food. The hardness of the food was shown to be a factor affecting the amount of Bennett movement or lateral translation of the working condyle. The harder the food, the more the Bennett movement. The working condyle makes a rapid return to a posterior and lateral position early in the closing cycle, where it holds, directly affecting the amount of medial closure of the lagging non-working condyle. The subject is now chewing carrots. The non-working side molar closures are consistently more medially located with the harder foods. In another display, multiple non-working side molar closures reflect the harder foods being chewed on the opposite working side. Our Bruxer with severely worn teeth was used for a number of different displays of total jaw movement. Included was the opportunity to study lateral joint stability or Bennett movement. Some dentists have doubted that Bennett movement exists, especially during chewing, while others have strived to precisely record and reproduce it in articulator. A selected border movement plot of this subject was copied onto a clear acetate sheet and suspended in the horizontal plane over the metal condyle. The condyle movements while chewing carrots are reproduced from the recorded data. This subject's occlusion was restored without changing the steepness of the cusps, thereby reproducing a pattern similar to the original worn-out occlusion, which meant the pre- and post-operative chewing were virtually the same. A mandible mounted in the replicator using the subject's previously measured coordinates provided an excellent frontal view of lateral condylar displacement during chewing as measured by a millimeter ruler. It has been termed the immediate side shift component of Bennett movement. Here is a direct close-up view of the plotter drawing in the horizontal plane this subject's non-working side condyle movements. In another display of horizontal plane movement, some selections from a previously recorded working side condyle chewing plot are superimposed over the top of the condyle of a mandible mounted in the replicator. The mandible is being moved by this subject's chewing data. This is a non-working movement, meaning the subject is now chewing on the opposite side. The grid is made up with 2 millimeter size squares. The articulator, mounted in the replicator, demonstrates movement of its lower member while being driven by the chewing data. The Bennett movement component is seen taking place in the retruded part of these working side chewing cycles. Total jaw chewing movements cannot be determined from reproductions of only the incisor point. Scrolling down this chewing series reveals a simultaneous condyle movement accompanying the incisor point movement shown above. The left side shows that the sagittal views of the working and non-working condyle movements are reproduced each with a normal-shaped eminence. Bennett movement takes place in the retruded part of the chewing cycle, shown by both the frontal plane view in the center and the horizontal plane view on the right. In most subjects, Bennett movement measures less than a millimeter. Each subject was asked to read with their recorders attached to analyze the character of mandibular movement while speaking. During speech, the mandible remains in the midline and makes very little lateral movements. Some antero-posterior movement takes place. The main variation noted between subjects was in the vertical interocclusal speaking space. The child with crossbite, shown here chewing cheese, has difficulty in selecting which side to use during chewing. He tries to chew on both sides, but doesn't seem to like either one. After orthodontic correction of the crossbite, he has changed now to a more normal chewing pattern. The replicator drawn chewing plots provide a clear picture of the changed chewing pattern. A young engineering student was being seen in our dental clinic by one of our dental students who brought the patient to our research lab asking if we would like to study how chewing takes place with this type of occlusion. The patient reported muscle and joint discomfort. He was aware of grinding his teeth when under stress and the chipping of some enamel of his molar cusps. The casts mounted in the replicator showed a mismatch in arch size. It was not possible for the mandibular facial cusps to close simultaneously in the central fossa areas on both sides of the opposing maxillary posterior teeth. Incisor point chewing plots clearly show how muscles react to this type of occlusal discrepancy. The sagittal plane view on the left shows only minor variations, but the frontal plane views on the right side of the screen give a dramatic picture of the type of a muscle activity required to satisfy the occlusal demands created by the crossbite. Subjects with excessive horizontal overlap of their anterior teeth provided an excellent opportunity to again demonstrate how the early return of the working side condyle by the elevator and jaw positioning muscles affected retruded closures of the mandible, and not by gliding contacts occurring on the incisors. At a time when anterior guidance was being taught in the curriculum, one of our dental students discovered that her husband could not bring his anterior teeth together. She became concerned that his teeth did not fit the category of normal or ideal occlusion. She brought him into our research lab for jaw movement evaluation and recording, and intraoral inspection confirmed that the only teeth in occlusion were the last molars. Replicator playback of the subject's cast provided excellent views of all aspects of chewing. The sagittal plane view of the third molars during chewing was the same pattern seen in normal occlusions. But the frontal plane view resembled the characteristic chewing pattern seen in the child, which shows frequent opening and closing movements that are laterally directed rather than opening down the midline and making lateral closing movements. Compare the chewing pattern of the open bite adult on the left side with the 5-year-old child on the right side. Another subject with the left canines in a Class 3 relationship gave us the opportunity to see what effect it had on the chewing pattern. The lingual view shows examples of chewing taking place on both the right and left sides. The right side working and non-working chewing patterns are typical for normal occlusion subjects. The subject's left side shows a greater distance between the two pencil lines drawn on the upper molar, representing the retruded limit and the intercuspal position. Here was an opportunity to study the role of the canines in the final working side closures. Frame-by-frame analysis showed the canine contact was delayed until the last millimeter before the mandible stops in the intercuspal position. Did pure mechanical gliding contacts of the canines bring the mandible forward to the intercuspal position? Or was it the result of muscle memory returning the jaw forward to its intercuspal position? Close observation would suggest that mechanical gliding contact may have had a minor role in the final forward closures. This patient had many missing teeth that eliminated posterior occlusal stops and resulted in vertical overclosure of the mandible. The chewing of peanuts was accomplished primarily with the anterior teeth. Dr. Fujimoto, one of our faculty members, restored the occlusion for this patient, giving us the opportunity to closely observe chewing before and after treatment. Post-operative chewing showed vertical closures characterized by precise occlusal stops with no evidence of sliding in and around the intercuspal position. Classic centric relation records were used for mounting the mandibular working casts in the articulator for fabricating the restorations. Guided lateral movements were initially used for articulator controlled settings and later for replicator comparisons. Now we could observe in all different aspects the patient chewing with the new restorations and the acceptance of the centric relation treatment position. The use of the term vertical chewing can be confusing because it doesn't describe the total chewing cycle. In normal occlusion subjects, closures typically begin with a wide lateral swing to the food side. Vertical closure refers to the very top part of the chewing cycles where the canines demonstrate their influence. Chewing soft foods results in the most vertical final closure movement. This subject is chewing carrots, a hard food. Notice now the extent of the contacts with the canines while chewing on both the right and left sides. Focus now on the subject's left canines during slow motion closures. The chewing of hard foods produces the more lateral closing movements. Again, compared to our bruxer, who has no canines or proprioceptive guidance to center the jaw, coupled with excessive lateral translation or Bennett movement, results in the flat horizontal rasping of all the teeth during chewing. The replicator afforded this unique opportunity to closely observe a long upper molar centric cusp during chewing. Cusp collisions are prevented by the coupled effect of the steepness of the opposite working side canines, the steepness of the non-working side eminence, and the stability of the joints. Lateral joint stability can be quickly assessed by using one of the simple recording devices. A range of Bennett movement of 50 subjects made by the Lee pantograph are displayed in the condylar housing of a Whitmix articulator. In this example, the Bennett angle guide can be adjusted in millimeter increments. The non-working side chewing series horizontal view shows how this same Bennett angle is built into the Panadent custom analogs. A typical chewing cycle shows both condyles translate forward and downward during opening. Watch the repeat opening. Notice how the teeth drop vertically. The translating condyles do not produce a forward movement of the teeth. Closing starts with a swing to the food side. Watch it being repeated. Closing shows the working condyle rapidly returning to its superior position, where it holds as the teeth in the non-working condyle return to their starting positions. The shape of the eminence on the working side has no tooth involvement during chewing because the working condyle reaches its posterior position before the teeth contact in normal occlusion subjects. Final working side closures are affected by the canines, not the steepness of the eminence. The non-working condyle closures closely follow the eminence. Molar collisions can occur as previously demonstrated, but non-working parafunctional movements are the primary concern. A subject's condylar chewing movements reproduced here in the replicator match the internal form of the articulator control, which was generated from a hand-guided recording. A simple student demonstration will now show the same principle. A horizontal reference plane drawn on the side of the face is established by the face bow, the same one used to mount the maxillary cast. Recording plastic plates are adjusted to the established horizontal reference plane. The pencil point of the stylus can be oriented to an arbitrary or a located hinge axis. Students can practice recording the steepness of the eminence and then record on translucent memo tabs aligned to the horizontal reference plane. The protrusive and non-working tracings are essentially the same. A clear plastic frame attached to the upper member of the articulator is scribed with the horizontal reference plane. Now it is easy to place the translucent memo tab recording on the plate, matching the subject's mandibular rotation point with that of the articulator. Another frame attached to the lower member contains a stylus aligned to the opening and closing axis of the articulator. The student can now rotate the condylar control to reproduce the steepness of their eminence. A number of excellent recording systems have been manufactured to adjust the steepness of the eminence. The next important step is for the student to discover how the steepness of the eminence, coupled with the opposite canine, affects the molar teeth on the non-working side. A student can quickly learn how a restoration with such a gross discrepancy can easily be avoided.